So this is our robot, and there are. It feels like I am a kid who are like showing my toy around to other grown-ups. But please, I'll begin my presentation. So our company is working on percutaneous coronary intervention robot. So we are aiming to provide a value that can go beyond robots. And based on the past research, we conducted exemplary clinical research, and now we're working on it. The background is that we're based on Seoul Asan Hospital. So based on that medical technology, we are bringing that to life. We were founded in 2019. It's a very small company with 14 members. In 2020, we began our project more actively. We came up with a project and we received a reward and we got approval as a venture capital. So we actively is working on our clinical studies. What we're focusing is heart disease. The texts are really small, but there are various heart-related diseases, and the red circle parts are our targets. When there's an heart failure, then the heart would stop. But recently, we inject this intervention robot in the vessel to conduct operation. So we are working on producing those robots for operation. These two, coronary angiography and coronary arterial intervention, are our main keys. So we monitor and inject robots and inject stents and conduct operation. So those coronoscopic vessels, based on the videos, medical doctors decide what to do with those vessels. So we wanted to come up with something more than that. So there are a lot of patients back in 2019. The intervention surgery, like using the vessels or conducting stent surgery, there are 80,000 patients, and there are patients who got diagnosis, like there are over 200,000. And when you go to the United States, the number is even bigger. Based on the research paper here, the number is this. Then stent intervention, there are about 1 million surgeries in the United States, and also in Japan, about over 1,000. And in China, about 700 to 800,000 patients who go under this surgery. The surgery itself may look very simple, like using a guiding catheter to guide the catheter, and then you inject a wire and conduct surgery. But you have to look at a non-visible part, so you have to use radiation. So patients might get exposed to radiation, so you need high skills to operate precisely, and it takes a lot of time. So even the operator and the patient, they both have limitations. And this is a small research paper. So medical doctors would make their decision. However, if you dive into the details, then when it comes to the diagram, so considering the length and diagram itself is really challenging. So medical doctors have to train themselves. However, it's really difficult to come up with an optimal operation. And this slide is for lack of proficiency. You need a lot of time to train. So on the first year of fellowship of medical school, they get used to it, but getting rid of those clocks is really difficult. And nowadays, the number of those specialists is lacking more and more. Korea does not have relevant statistics, but in Japan, many thousands are in short when it comes to specialists. So we wanted to use robots to narrow down the gap between supply and demand using this percutaneous coronary intervention. So there are various ways. Those manual operations in the past can be replaced with robots. So medical doctors' decision can be aided with artificial intelligence to raise accuracy. So the tool between that connects humans and robots would be our technology. And one dramatic effect is that we can deal with acute myocardial infarction. So nowadays there's increasing cases and deaths. I personally haven't heard, but there was a TV documentary program. When you go to Ulung Island, there is a hospital for this. However, there is a hospital, but in short of medical doctors. So if there's a patient, you have to use a helicopter. Of course, they are close to the hospital, but still you have to use a chopper. So this is our goal. But our competitor, the United States or Germany, there's a competitor company who actually is practicing remote diagnosis. So this is different from operation because operation needs more details and complex technology. But if it's not operation but monitoring, then as long as you can come up with accurate monitoring aided by medical doctors, then you can come up with a very efficient way. But as you may know, there are many constraints. So realistically, it's very challenging. But if we use robots, then we can still benefit from this. So it's not only us who thought like this, but there are many competition companies in the market. It will likely increase. There are some like trillion Korean won worth scale or others the market would be. But what we think is that the surgical, but compared to other market, we're in the early stage. The market itself is in the early stage, and now because of the COVID-19 pandemic, every company in this field is at the early stage. Of course, we might be quite lag behind, but we can follow up in this field. And there are two big companies, Corindus company. So when it comes to Corindus, I'll elaborate later, but Corindus is acquired by Siemens in Germany, and we are currently following them rapidly. And we have been developing this technology for 7 to 8 years, and we have began our vascular surgery robot back in 2017, and we completed them. And there's a video, I'll just skip it. And here, back in 2019, in October, we conducted our exemplary clinical studies, and currently, after the exploratory clinical trial, we're completing our second trial, and we have reached the level of other competitor companies overseas, and now we want to come up with a more strong device, working on AVR 2.0. And here are our techniques, technology. They're not yet perfect yet, but for those surgeons, they say they want this feeling of manual operation. So we have to provide them with the sense where you can interact with your hands and the robots. So we have secured that technology. We, based on our haptic devices, thanks to the haptic rendering, we have this technological strength over other competitors. And this detail is that it requires a lot of high difficulty operation, and other competitor companies, they are focused on relatively easy operations, but when you want to use them to highly difficult operations, you need more complex technology. So that is what we felt when we worked on our AVR 1.0. So we upgraded that in our 2.0 model. And when it comes to medical robots, there are key mechanisms and there are other aspects that you have to consider, like at labs and hospitals or research institutes. When it comes to cardiology, and there are a lot of researchers who are interested in this, and there are a lot of bodies of research, like there are a lot of papers. But actually, when you jump into the market itself, when you want to actually use them, you have to think about various details. For example, you can see on this slide, we have considered various details, the sizes, the angles. If you make one single mistake or error here, then there are a lot of difficulties and challenges that the machines wouldn't work properly. So we want to go beyond those issues by overcoming the difficulties. So we are breaking the challenges. So that is what that is a strength of ours. Now we're living in the era of artificial intelligence, and one is like auto operating, just like self-driving cars. We can think of self-operating robots or doctors. They need a lot of skills in order to properly read and monitor and analyze data. So when they reach a risky part, then you can get alerted. So then you can prevent risks. So we have reached that level. However, since this is a medical device, we have to get licensing. So there are steps to take. So we are planning to work on the safety issue, and also when it comes to self-operating, we did complete that stage through animal experiments. Then we will move on to the next step. But in the past, when human doctors used their hands for manual operation, now in the long term, we have to move on to shift to the next stage where robots can operate. So we made a prototype for AVR 2.0, and as I told you, we already completed the feasibility with AVR 1.0 2 years ago. And internally, we have discussed various issues and came up with many internal systems needed for our project. So today, when it comes, we are currently working on the second day of GMP experiment, and there were no issue. So based on our independent own manpower, we have our own capacity to work on this. So in the second half of this year, based on our 2.0 model, we would like to move on to the confirmation trial in the end. And we are currently working on to expand to the US market. And 1 week ago, we got the result of the pre-submission of the FDA. And I think we can move on to the world class market. So we did get that assessment. However, one thing to worry about is that only based on our clinical results in Korea, it might be difficult to get recognition in the US market. So that is my personal worries, but I wish many good investors would show up to help us. So we are not just focusing on building robots, but we have this common sense. Like many people can come up with creative operative measures and come up with a lot of different ideas and share them on our platform or infrastructure. That is our ultimate goal. And the insurance is another challenge, but I'll talk about it in detail. There are other diagnostic machines like ultra radio, UV, or other OSCs, among others. Patients have to pay with their own money on top of the coverage. So medical robots require a very high cost, but thanks to, if we successfully adopt this medical coverage, then that medical expenses will decrease. So if we successfully do so, I think this will bring a lot of potential effects, but might be challenging to complete it. And our company is not just a company who just popped up from nowhere, but we are based on this hospital, and we do have backgrounds. But of course, our company is a small one, so we need a lot of affiliation or partnership. And if we successfully secure my background, finances or backgrounds, then we will be able to expand our business. And how and when and who should pay for this project is one of the worries that you suggested. Then of course we do have those issues. You can use this robot. That recognition might be easy, but who should purchase it and who should use it? That is another question. And we need a huge number of clinical history records, and we have to pay for the expenses for the clinical studies and those clinical patients. That might be a challenging part, but the effectiveness of this medical robot is so obvious. So if we successfully make it sure that everyone can trust that this robot is very effective, then we will resolve that problem. Another foreign case is Siemens acquired a company to work on it, and also China acquired a French company to work on this field. And also, we also is working on a futuristic plan to develop our robot. Another thing is that we are living in the era of COVID-19. That what if we had a much advanced robot? Then maybe we could have provided much more better medical services to patients. So in order to prevent that from happening again, we wanted to come up with a solution. That is the end of the presentation. Thank you.